Hello, everyone. My name is Nadja Kabisch, and I'm from the Humboldt-Universität to Berlin. I'm working at the Department of Geography there in a research group, which is called Green Equity Health. And this is actually also our project, which I would like to present you today here with some examples. And the main topic of this presentation is scientific vision of urban green infrastructure as nature-based solution to global challenges. I brought a little agenda, so just to lead you through. So what I'm going to talk about is that I will provide firstly a bit of background. So actually, what are the global challenges we are talking about, basically for urban areas, for urban systems? What are here kind of environmental health interactions? What are actually nature-based solutions? And what are urban ecosystem services that are provided by green infrastructure? I would like to lead you through some examples then from the research project, from the Green Equity Health project, and show you this from a very interdisciplinary perspective. And finally, I would like to come up with some hopefully interesting scientific vision of how we can go further with researching urban green infrastructure as a nature-based solution to global challenges, which should also be kind of innovative. Okay, then let's start. First, so what are actually the challenges for dynamic urban systems? So, and I always highlight that one of the challenges is urbanization. So you maybe know the numbers, and I brought here some from the United Nations. So actually, we are with 4.2 billion people in urban areas, which was a number from 2018, and we will come up with 6.3 billion in 2050. So there's a huge increase actually in people living in urban areas, and this will increase further, and it will also increase on the land use for urban systems. So urbanization increase and people living in urban areas will come up with some very extensive challenges, such as air pollution, think of noise, think of densification, think of losses of urban green, blue, and open spaces. So there's another challenge I would like to highlight here, and this is climate change. So climate change also impacts on us, on health, and also on well-being of all residents, but also particularly of city residents. So you may know about the droughts and the heat waves we had the last 2 years. So urban areas are affected by climate change and urbanization, but they also provide great opportunities for health and well-being. So in this picture here in the back, you can see, maybe you know it, it's from the Tempelhof area in Berlin. So it's an inner city green space, which was a former airport and is now an urban green space. So, and this is an example of a nature-based solution. So cities are facing these kind of challenges, but they're also generating innovation. And one of them is nature-based solutions. Nature-based solutions can be defined as a kind of a sustainable solution that use ecosystem services to address global societal challenges. So what are ecosystem services? You maybe know it. I will define it for you again. Ecosystem services are basically those benefits human gains from nature. And they are in urban systems, basically provided by the urban green spaces or by green infrastructure, which has a planning component as well. So what could you understand as nature-based solution? What are actually nature-based solutions? So this picture here shows a kind of a street-line tree and a tree-line street in Brazil, basically providing a number of important ecosystem services. So you maybe think of a cooling function, so providing cooler temperatures. It provides air quality improvements, noise attenuation. Maybe you can also think of recreational opportunities or energy saving opportunities. All these kind of involvements, instruments where nature is involved, count as a nature-based solution in our understanding. And what I would like to highlight for our project is that there are some ecosystem services that are particularly important for health and well-being. And those are the kind of, think of the cultural ecosystem services that are provided by parks. So simply the opportunity to do sports, to relax, to recreate, providing the space for social activities, for social interaction, but also for environmental learning. So with this in mind, we followed several research questions in our project. I would like to highlight some of them. So actually, we were looking at how do these kind of urban ecosystem services actually perform under novel stressors. With novel stressors, I mean like heat waves or droughts, which were not been extensively experienced before, like we had in the last years. Then actually, what are the health outcome effects of contact with nature? So are they actually quantifiable? Is there evidence we can prove? And finally, how can we include the knowledge we gain potentially from our research? How can we include this knowledge in urban planning strategies? So I would like to provide you with some examples for the first questions from our project. And it's a bit detailed, but I think it's good to see how research, how is science actually dealing with these kind of facts, and how can we measure it? So the Green Equity Health Project was funded or is funded for 5 years from the German ministry. And what we do is we are doing research and measurements in urban green spaces in the city of Leipzig, which is like 200 kilometers south of Berlin. It's a growing city with nearly 600,000 inhabitants at the moment. And Leipzig is interesting also as a case because it was severely impacted by the heat and drought waves in the last drought periods in the last 2 years. So, and you see here, we have done measurements in 2 parks, the Lene Vogt Park and the Friedenspark. These are 2 inner city parks, which are super different. So the Friedenspark is a very old, grown park with a large tree coverage, while the Lene Vogt Park is a new park built on a former railway brownfield, quite open, less tree coverage. So both parks are quite different. And we were now interested to see how actually the climate regulation function can be proven in these parks, even under very hot and dry conditions. So I would like to show you some pictures of those 2 parks. So this is the Lene Vogt Park, how it looked like in March 2018. And this is the park, how it looked like in July 2018. So you see how the vegetation was impacted by the drought conditions and the heat conditions. This is the other park. This is this old grown park, the Friedenspark in Leipzig, a picture taken in April 2018. And this is the park again in July 2018. So, and you see how the conditions changed, how the vegetation health was changing there. So it was very hot, it was very dry, and conditions for vegetation was like early autumn. So what have we done basically? So we installed this kind of measurement devices, air temperature, air humidity measurements all over the 2 parks, which you can see here and here. And we were measuring temperature in 2 different heights to see if there is still an impact, a cooling function of this green infrastructure, of this green space, even under very, very hot conditions. And here's a result where we found that, as you can see here on the right side, that both parks actually provide a cooling function even under very, very hot conditions. But the older park, the Friedenspark, and this was also our hypothesis, which we could nicely prove, still provided cooler temperatures compared to the new park, the Friedenspark, which is here a bit north of the Friedenspark. And this was quite interesting to see because we thought that maybe because it was very, very high in temperature that the cooling function would be lower, but still we could prove them. Okay. We were also interested in how this kind of regulation function is linked or can be linked to a certain health outcome effect. So is it measurable? Is it also perceived that there is a potential health effect for those living in near of these parks or for those visiting those parks? And I provided here some initial results from the health campaign we did then a year later it was in 2019. So we were basically working very interdisciplinary and trying here to incorporate a study informed from also from social science, where we used a sample of 36 participants of a rather vulnerable group. So the young elderly, you could say so, aged 55 to 75. And we were doing this health experiment by exposing those people to both parks, to the Lene Vogt Park, the Friedenspark, but also exposing them to a very heavy street area, which is near both parks. And we were equipping them with this kind of ECG measurement, and we were also doing pulse, pressure, and heart rate measurements, and we were also doing a lot of questionnaires. So they had to fill in or from psychology. So, and I brought some initial results here to show you. I hope you can see it a bit. Actually, the animation doesn't work, of course. That the red one, so on the left side, this is the result for the Friedenspark, and it's the restoration outcome scale. So it's a kind of assessment, a perceived health assessment by the participants, saying that how relaxed you feel after your visit in this park. And the higher the values, the more relaxed they are after this visit. And you see it here for the Friedenspark and for the Lene Vogt Park. So both environments are actually counting higher compared to this very heavy loaded street area, which is here called in blue, is called the Ostplatz. And the same we also found for the ECG and the heart rate variability measurements, which is up here. So where you can see that, actually in the greener environments, we had more relaxation, more activity in the parasympathetic nervous system with higher rates, which also indicate a higher relaxation. So what does this actually mean to us? So we could, on the one hand, prove that we have the cooling function, and on the other side, we also could prove perceived health improvements, but also very objectively measured health improvements. So how can we now include this kind of knowledge on ecosystem services in urban green planning strategies? So what have we done? And here I would like to show you just some illustrations from our project and from an earlier project. So right from the beginning of the projects, we were always communicating with urban planners, with urban decision makers in the respective cities. So we've done an earlier project, which was called the Urbis project, on urban ecosystem services and biodiversity in Berlin. And similar to this project, also in the Green Equity Health Study, we were inviting planners, we were discussing with them our questions, our research questions, but also our approaches, so how to further deal with this. And we actually had some good conversations with them and some project flyers, but also a video was generated, which is now always still used by them. So I have 2 minutes to go, but I would really like to show you the scientific vision of our urban green infrastructure projects and what can we learn, what can we further do with this. And I brought here a vision which is, I think, very nicely illustrating also the ecology of cities. So this figure is from my colleague Timon McPherson from the New School in New York, nicely showing how urban ecology is integrating different disciplines like urban planning, like urban design, like sociology. And he also provided in a nice paper all these kind of different disciplines. And all what I told you today in this interdisciplinary project can be summarized under scientific disciplines related to urban ecology. But what is missing here, or what has not been pronounced so much, is the discipline of health. And this is actually my vision, to include much more the health perspective in all of these kind of very interdisciplinary considerations. And what we are doing in the next years, and this is really my hope, that we are further producing evidence on how regulating ecosystem services are providing the benefits to people, but also how is this actually related to mental health, to physical health of people. Still, what can we do with these results in terms of urban planning? Maybe we can even provide or come up with a public mental health strategy where all this kind of different, very interdisciplinary research comes together. And finally, I would also like to further work on the theoretical foundation of this to really ground this health perspective in urban ecology. So, and with this, I briefly would like to show you that there is a further reading, and if you like, we can discuss this further. Also, via email, and we are maybe nice conferences that should come up in the next years. So thank you very much for listening, and I hope you keep in mind that urban ecology is a very interdisciplinary discipline where nature-based solutions, ecosystem services, and health comes together. Thank you.